The final piece of the puzzle when we talk about PTSD is really treatment, right? So we talked about how to diagnose PTSD. We talked about what are some of the common causes of PTSD. We talked about what are some factors that lead to one person getting PTSD more frequently than the next person. But in this video, we're going to talk about treatment in broad strokes. I'm not going to decide or separate the debate as to whether cognitive behavioral therapy is the best approach or another approach is better. There are a whole host of treatments for trauma, and without exaggeration, we're hundreds of treatments, right? So that's not my focus. My focus will be kind of like, well, what is the practitioner going to do? What are they going to emphasize, regardless of their theoretical orientation? So, in order to set the stage, I think it's important to understand that trauma left untreated doesn't usually go away. So we see that people tend to have PTSD symptoms long after. So if you receive treatment, um, it might go away in about 3 years, but even double that time without treatment, people still have symptoms of PTSD. We also mentioned in an earlier video that Vietnam vets, there's a whole host of Vietnam vets who still are experiencing the difficulties surrounding PTSD. Okay, so your treatment type is going to differ based on the kind of trauma and based on the theoretical orientation. But what you will see is, regardless of theoretical orientation, there are three overarching goals, and it is in a stepwise progression. The first is to, address the stress reaction. So whatever the lingering stress reaction is, that's the first thing that you're going to target, because that's what's creating all of the psychological and physiological discomfort in your patient. After you address the stress reaction, then you can kind of help the person separate from the trauma and gain perspective on the traumatic experience. That isn't to say that the trauma was a positive thing in one's life, but it means that they can have some insights as to what happened, and how to address things like that in the future. And then last but not least, you want to make sure that people go back to a constructive lifestyle similar to that they experienced prior to the trauma. Now, in terms of treatment, when you see drug treatment, this is for combat veterans, but the truth is it doesn't have to be combat veterans in isolation, right? If you're going to use pharmacological agents, the most common drug therapies are anti-anxiety medication, things like Xanax for breakthrough anxiety, and antidepressants to deal with things like sadness and distress. We also have behavioral techniques such as exposure therapy. So you might have heard of something called EMDR, eye movement desensitization and reprocessing. This is a technique where you expose your client to the trauma using a process of flooding, right? It can be in vivo in live flooding, or it could be more of a covert or imagery technique. It can even be through virtual reality, but we expose them to the trauma under supervision and provide them relaxation training to teach them how to calm down. And then EMDR is flooding while having them do eye movements and tapping. EMDR has some research to support its ability to address trauma and stress. Other people are critical of EMDR. Another technique is more of an insight-oriented therapy. So we're trying to say, well, I know you experienced this trauma, but let's get to the root of what you're feeling around the trauma. So whatever the deep-seated feelings are, we want you to access them, right? And learn to, if there's some form of guilt, teach you how to lessen your guilt, teach you the process of developing acceptance. And this could occur in individual therapy, it could occur through group therapy, family therapy, etc. And once again, you don't have to use one treatment or the other. Oftentimes, these are done in combinations. Now, when we talk about community therapy, when you have a mass disaster, we have something called critical incident stress debriefing. And the goal is to help whoever the survivors are get their basic needs met as soon as possible. And then that's your physical needs. When it comes to psychological factors, you want them to normalize their response to the disaster. You want them to share whatever anxiety, frustration, etc. they have. You want to teach self-help skills, and then you want to provide referrals. It's very important to understand that critical incident stress debriefing is not long-term therapy. It is designed to help a person cope in the immediate wake of a disaster and then get them into proper treatment. The American Red Cross has a program called emotional first aid, or psychological first aid, better yet. And psychological first aid is used in a similar fashion, where the American Red Cross teaches people how to triage a mass trauma and then refer them out. Now, don't forget to put your oxygen mask on first. And I say that because if you are going to go to a mass disaster, some natural disaster, it is possible that you too can experience trauma and become overwhelmed. So be mindful that even relief workers can become overwhelmed by a traumatic experience. We saw that with 9/11, for example. So put your oxygen mask on first, make sure you take care of yourself, and then approach whatever kind of relief work you're doing from a position of strength. And that, in a nutshell, is our series on stress related disorders. So I'm going to stop there, and we'll continue with our mood disorders next. Take care, everybody.